Vitamin D status and trabeculectomy outcomes. Vitamin D is a crucial nutrient, actually a hormone, known for maintaining bone health, but it also modulates the immune system and inflammation in many tissues, including the eye 625. Glaucoma, a progressive optic nerve disease, is driven partly by high eye pressure and damaging inflammation. Some studies have found that people with glaucoma tend to have lower blood vitamin D levels than healthy controls. 9. Animal and cell studies suggest that the vitamin D hormone, calcitriol, can protect retinal ganglion cells, the nerves damaged in glaucoma, and reduce inflammatory signals in the eye. 6. In fact, in trabecular meshwork, drainage cells under stress, vitamin D3 blocked many abnormal changes, excessive matrix, collagen, inflammatory cytokines that contribute to glaucoma pathology. 6. These findings imply vitamin D could help guard the optic nerve and enhance fluid outflow. However, clinical evidence on glaucoma progression is mixed. For example, one recent study found that glaucomatous progression, changes in visual fields or nerve structure over time, was not significantly different in patients with vitamin D deficiency versus those with normal levels 3. Likewise, an ocular disease review concluded there's no clear link between serum vitamin D levels and glaucoma severity or rate of worsening. 6. In summary, observational data are inconsistent. While many case control studies report lower vitamin D in glaucoma patients. 9. Cohort data do not clearly show that deficiency causes the disease to progress faster. 3. Vitamin D, immune modulation, and wound healing. A trabeculectomy creates a flap that drains fluid under the conjunctiva. Proper healing is crucial. Too much scarring, fibrosis, can close the new drainage pathway, while too little healing can lead to leaks or infection. Vitamin D's immunomodulatory role may influence these processes. It is known to suppress excessive inflammation and promote tissue repair in general. 3225. For example, ocular surface studies note that vitamin D dampens chronic inflammation but can enhance early healing inflammation and innate defenses. 32. In a mouse model of corneal abrasion, topical vitamin D actually increased neutrophils in the wound and slightly slowed initial closure, 17% delay at 18H, but it also upregulated antimicrobial peptides. 32. In practical terms, this suggests vitamin D is a double-edged sword. It might prolong the acute inflammatory phase, fine if controlled, but also strengthen early immune defense. Importantly, vitamin D has anti-scarring effects in the context of eye surgery. In lab culture of human tenons fibroblasts, cells that cause scarring after trabeculectomy, vitamin D3 significantly inhibited cell proliferation and migration without harming cell viability. 17. These results indicate that higher vitamin D levels could help prevent the subconjunctival fibrosis that blocks filtration blebs. The authors suggested vitamin D3 might serve as a low-toxicity adjunct to standard antifibrotic agents after glaucoma surgery. 17. Vitamin D also supports the health of the ocular surface. Adequate vitamin D stabilizes tear film and nerves on the cornea. 25. Vitamin D deficiency has been linked to worse dry eye symptoms. Studies show patients with chronic dry eye often have lower vitamin D than normal and have worse tear production and symptom scores. 24. Supplementing vitamin D improved dry eye in both clinical and experimental models. 25. For example, in one small study of cataract surgery patients, those given vitamin D supplements maintained better tear volume and comfort than controls. 34. By analogy, after trabeculectomy, when topical glaucoma meds and surgery can cause dryness, ensuring sufficient vitamin D may help the ocular surface recover more quickly. 25. Postoperative repletion, timing, doses, and safety. When to start repletion. There is no formal guideline for glaucoma surgery specifically, but general practice is to correct clear deficiencies. Waiting about 2 weeks after trabeculectomy is reasonable. The acute inflammation and epithelial healing have usually settled by then, and starting vitamin D does not appear to disrupt normal wound repair. In fact, delaying beyond initial healing may forego the protective anti-inflammatory effects. The approach might be measure vitamin D, 25 OH vitamin D, soon after surgery, and if it is low, begin repletion a week or two later during routine follow-up. How much to give? Common repletion strategies follow endocrinology guidance. If blood 25-OH vitamin D is below 20 nanogram milliliters, 50 nanomol, a loading dose is often used. For example, 50,000 IU of vitamin D3 once weekly for 6 to 8 weeks to rapidly raise levels 59. Alternatively, some regimens use 5,000 to 8,000 IU daily for a similar period. After this loading phase, a maintenance dose of 1,000 to 2,000 IU daily is typically continued 59. These amounts are within safe limits for most adults. Another option is a modest daily dose, e.g., 2,000 IU, started immediately. This will gradually raise levels without a sharp initial spike. The best strategy depends on how deficient the patient is and any risk factors they have, absorption issues, obesity, etc. Safety, hypercalcemia risk. Vitamin D by itself very rarely causes problems at usual doses. The Institute of Medicine's upper limit is about 4,000 IU per day for adults 99. Taking vitamin D in recommended ranges is generally safe. Problems can occur if extremely high doses are taken or if other factors raise calcium. For example, older patients on thiazide diuretics, a blood pressure medication, are at higher risk. Thiazides reduce calcium excretion, and if such a patient also takes high-dose vitamin D, especially with extra calcium supplements, their blood calcium can climb too high 45. Indeed, case reports describe elderly patients on thiazides who developed hypercalcemia when taking vitamin D plus calcium 45. To stay safe, patients should avoid exceeding 4,000 IU per day for long periods unless under physician supervision. It's wise to avoid unnecessary calcium supplements at the same time. The safe approach is to pick a reasonable dose, often 1,000-2,000 IU daily, and check levels after several months, rather than using extremely large one-time doses in someone on a thiazide. Where needed, monitoring blood calcium catch any issue early 45. Interactions. Other glaucoma medications generally do not interact with vitamin D. However, if the patient takes any calcium-based antacids or high-dose multivitamins, that adds to the calcium vitamin D load. In summary, caution is mainly for thiazide diuretics or kidney insufficiency. Both increase hypercalcemia risk with vitamin D45. Otherwise, vitamin D repletion is quite safe when dosed appropriately. The risk of actual vitamin D toxicity, very high levels causing hypercalcemia, kidney problems, etc., requires far more vitamin D than typical supplements provide 48. In ordinary cases, levels up to 150 nm or 35 nm have been needed before true toxicity appears 48. Thus, modest repletion aimed at normalizing levels 20 to 40 nanograms per milliliter poses minimal danger. Take-home and testing recommendations. Put simply, vitamin D deficiency is treatable and may help after glaucoma surgery. To be practical, test when indicated. Patients with risk factors, older age, limited sun exposure, malabsorption, osteoporosis history should have their 25-OH vitamin D measured. The Endocrine Society defines deficiency as 20 nanogram per milliliter and insufficiency 20 to 30 nanograms per milliliter. If levels are low, plan repletion 59. Routine screening of every patient is not mandated by guidelines, but reasonable clinical judgment can apply. Treat if low. For someone just after trabeculectomy who is deficient, one can use a supervised loading regimen as above in the weeks after surgery, then downshift to a maintenance dose. For example, a common course is 50,000 IU once weekly for 2 months, then 1,000-2,000 IU daily thereafter, 59. Alternatively, modest daily dosing, e.g., 5,000 IU day for 1 month, then 2,000 IU day, works. The goal is to raise blood 25-OHD into at least the 30 to 50 nanograms per milliliter range. Some specialists aim 30 nanograms per milliliter and keep it there. Monitor. Recheck vitamin D after a few months to confirm the level is up. Also monitor calcium if there are risk factors, kidney disease, thiazide use, hyperparathyroidism. Individualize. Elderly or those on interacting meds, thiazides, digoxin, etc., may need smaller doses and closer follow-up. Weight and body fat can affect dosing. Obese patients sometimes need higher doses. Work with your doctor or nutritionist to tailor the dose. Conclusion. While no definitive clinical trials yet show that fixing vitamin D levels will speed trabeculectomy healing or prevent glaucoma worsening, the potential benefits and low risks support at least considering it. Vitamin D deficiency is common in older adults, especially those with less sun exposure. Given its role in immune regulation, tissue repair, and ocular surface health 2517, optimizing vitamin D status makes sense as part of comprehensive glaucoma care. In practice, we suggest test or estimate vitamin D status, and if low, start a sensible repletion plan about 2 weeks after surgery. Keep doses in a safe range and watch calcium levels if any risk factors are present. 48. This individualized approach, guided by office labs and patient factors, balances maximal support for healing against any small risk of overshoot. Tags vitamin D, glaucoma, trabeculectomy, wound healing, immune modulation, dry eye, hypercalcemia, calcium supplements, thiazide diuretics, ocular surgery. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.